right, welcome everybody again. So this is Dr. Kehinde Elisha, founder of MP Certification Academy. Welcome to January 2024. So we're going to be going over some personality disorders and it's going to be really quick. It's going to be mostly images, nothing too serious. I will do my best to break it down and also give you some mnemonics. I will do my best to keep it under 20 minutes. So let's get started. Personalities kind of makes us, like it's who we are. It's nothing anybody can really change. It is something that somebody can modify based on your own awareness of it. But the person that actually owns the personality, they don't even realize it. Some people don't even believe it exists. So we have personalities and we have disordered personalities. So disordered personalities are just extreme personalities that people don't even realize. So we all have these personalities, we all go through it, but I'm saying extreme in the sense that it is just way beyond normal. We all get happy, we all get sad, we all get angry, we all have these emotions. But some that are a little bit over the top is what we are talking about. That is what we call disorders. So let's quickly go over the summary of this chart. The clinical personalities are divided into three. We have cluster A, cluster B, cluster C. Now, cluster A is the paranoid, schizoid, schizotypal. Cluster B is antisocial, borderline, histrionic, narcissistic. Cluster C is avoidant, dependent, and obsessive compulsive disorder. Okay, so let's dive through each of them. Paranoid, distrusting, suspicious, interpretation of motives of others. When you blink, they give it a meaning. When you cough, it is given a meaning. Schizoid, social detachment. On national exams, they tend to, emphasize these keywords. These are like some basic keywords that you don't need to memorize, but with repetition, it's going to stick with you. Schizoid, social detachment and restricted emotional expression. Now, schizotypal, social discomfort, cognitive distortions, behavioral eccentricities. So this particular cluster, we call them odd and eccentric. Now, the next cluster is cluster B. That is dramatic and erratic. So we have antisocial, we have borderline, we have histrionic, we have narcissistic. In total, we have 10 types of personality disorders. Antisocial is what? Is a disregard for and violation of rights of others. Borderline is unstable relationships, self-image effect, and impulsivity. Histrionic, excessive emotionality and attention seeking. Narcissistic is grandiosity, need for admiration. That is who a narcissist, like they want to be admired, but they don't know how to admire and respect other people. Cluster C is avoidant, dependent, obsessive compulsive disorder. So who is an avoidant personality disorder? They are socially inhibited. They have feelings of inadequacy, hypersensitivity to negative evaluation. What about dependent? Submissive behavior. Need to be taken care of. What about obsessive compulsive? Preoccupation with orderliness, perfectionism, and control. So look, obsessive compulsive personality disorder is not the same thing as obsessive compulsive disorder. Obsessive compulsive disorder, they are ego dystonic. They dislike being that way. Obsessive compulsive personality disorder, they are ego symptomatic. They believe it's okay the way they are. That's the way things supposed to be. Orderliness is great. It's extreme orderliness that is affecting your life that is a problem. And that is what we call obsessive compulsive personality disorder. Now, let's now go straight into the real visual image of these personality types to bring things home to all of us to make it make more sense. So cluster A, we call them odd and eccentric. How do you remember the things underneath it? You're going to take your P, the A, you throw it in the middle, and then it's going to be pass. P-A-S-S, pass. Okay, so now I know my pass is going to be paranoid, schizoid, and schizotypal. So the first one is paranoid. Look, all like, oh my gosh, the whole world is going to fall apart. They are paranoid about every little situation, every little event. They are giving everything interpretation, meanings, and so on and so forth. That is a paranoid personality disorder. Schizoid personality disorder, these are loners. They believe it's safe and okay to be alone. They are blaming God for creating other people. They believe it should be them and them alone in this world. They don't like to see people around and they don't believe in it. What about schizotypal personality disorder? Schizotypal, these are magical thinkers. Perhaps she's thinking right now that, oh, that curtain is going to turn into a rain. That is just the way they see it. That is a disorder. Some people think they are weird. We can't really call them weird. That is just their own perception of stuff, but it's different from human experience or normal human experience. Now, cluster B for boy, we call them dramatic. Now, cluster B, dramatic type, we have antisocial PD underneath it. Antisocial personality disorder. So with antisocial PD, what do we see? We see someone that is, more like not a criminal, but they will do things that will probably land them in jail. They will do extreme things that will potentially land them in jail. Even when they get angry, it's to the extreme, and of course to the point of being destructive too. What about borderline personality disorder? I'm sorry for the images here, but based on literature, this guy on the right actually happened to be known to have borderline. I am demonstrating with these images to also show you that women have reputation for being borderliners. We actually have men borderliners too. And men borderline tend to actually be worse than the women, meaning the way they are emotionally reactive over little things. They are not able to manage their emotion. They go to the extreme when it comes to emotional expression. So that's why I came here with this. So with borderline, what do we do for them? We tend to do DBT to help regulate their emotions and for them to maintain that positive outlook to life. Now, Amber Heard actually was found that in a court record, it was listed that she's actually both histrionic and borderline. She was a little bit dramatic, that I actually thought is because she was an actress. That's why she was doing what she was doing. But then they found that she actually, in fact, is a borderliner. And she also has histrionic traits. That was according to court record. But what do you see them do, though? They are also emotionally reactive. Histrionic would be like, hey, that person held it up for me. Oh, he's in love with me. She's in love with me. They take everything to another level in a heartbeat. They take things to extreme. Narcissism. Now, I am not saying for sure she's a narcissist, but according to the internet, there's a little thing that she is a narcissist. But why am I demonstrating with a woman? I am also demonstrating here to say it is not only our men that are in fact narcissists. We also have women narcissists. Let's keep that in mind because the focus is solely on men. That is not true. We also have women narcissists. Who is a narcissist? They want to be admired. They have extreme need for it, but they don't know how to give that in return to other people. That is who a narcissist is. We're now going to talk about the last cluster. That is cluster C. Anxious, fearful. That is pretty much the general summary for that cluster. So the first one that we have on that cluster C is avoidant personality disorder. These guys, they are similar to people with schizoid, but they truly don't want to avoid people though. They just want to avoid people for fear of embarrassment. That is why they would like to be alone by themselves, because they feel like they're going to be insulted, they're going to be embarrassed. They don't want to go through that, so they rather isolate. In the process of isolating, they are now looking like what? A schizoid. So on any national exam, you will see avoidant and schizoid being put together, and in real life, you can mistaken avoidant as a differential diagnosis for schizoid. That's why you have to get a whole picture during your assessment before concluding on the diagnosis. Dependent personality disorder. This is just a nice little cute kid. I just kind of demonstrated it for my visual learners to capture this in their brain. He's not being dependent. He's just being a kid. But they kind of represent how dependent personality people can be. They want to cling on people's shoes, clothes, or things, and just say, you can't go anywhere. I'm going to have to cling on to you. They call you in the morning. They call you at night. They are like on you. We all depend on people at some point of our lives, but these ones are overly dependent. Obsessive compulsive personality disorder. They are egocentric. They are the perfectionist. They want to be in control. They don't even realize how much they control people or people's lives, and they feel uncomfortable if they cannot achieve that. And in reality, nobody wants to be excessively controlled. People have the mind of their own too. So these people tend to struggle with relationships. All right, that is the end of personality. But there is something else I would like to go over with you. The little key things that I normally use as a way to remember your key concept when it comes to personality disorder. Speaking here is Dr. Kehinde Elisha, founder of NP Certification Academy. You want to reach out to us for your board exam review or for counseling about relationships, Nursetonursecoach at gmail.com. So paranoid is not trusting. Schizoid are loners. Schizotypal are magical thinkers. Borderline, they are emotionally reactive. Antisocial are criminals. Histrionic are attention seekers. Narcissistic are egoistic. OCPD are perfectionists. Dependent depends on people. Avoidant avoid people for fear of embarrassment, but they are not schizoids. Now, one more thing I want to quickly tell you, it's not the questions here. I want to take you here to be the beautiful summary, and I will end this whole piece of personality disorder. We have mnemonic, pass, band, and coda. Category cluster A, I mean to say, they are odd, they are unusual, they are eccentric, they are asocial. That is the pass. You take that P, you throw A in it, it forms pass. Paranoid, schizoid, schizotypal. Got to know your clusters and the personality types to go with it. Cluster B is borderline, antisocial, histrionic, and narcissistic personality disorder. They are dramatic, they are affective, they are unstable. Cluster C are anxious, and that is usually obsessive compulsive personality disorder. That is OCPD, and they have dependent personality disorder. They depend on people. Avoid, they want to avoid people for fear of embarrassment. It's not because they really want to avoid people. They truly admire relationship. They want to be in relationships, but they just cannot deal with the embarrassment or insults that comes with relationships. So they rather isolate. I really hope this makes a lot of sense to you. Do we have any questions? So thank you so much for taking time to attend our short session today. I really hope you like our demo. If you do, this is Dr. Kehinde Elisha, and we offer exam reviews for Pmhnp. We have Pmhnp Ncmhce, and we have Pmhnp AANP. ANP is also going to start offering Pmhnp exam starting from spring. So please just know that we also offer that review, and you're free to sign up on our website, www.npcertificationacademy.com. We also offer AGNP, AGACNP exam review. We also offer NCLEX exam review. We have 99.9% pass rate. Exam is content. Content is key. We give you all the tools that you need. We also set you up with Canvas, where we have our class notes all laid out. No struggle to get Zoom link. You can reach somebody usually via email or by calling 347-901-6037. Again, 347-901-6037. We have done this for a while now, and we know the tricks. So why don't you give us a try? This is 2024. Get your goals set up and achieve them. Dear visualization, I'm just going to go ahead and take you through our website so you can know exactly what I'm talking about, because I mentioned 2 different websites. For 2 different purposes. I want to make sure that you're going to the right ones. That is the question that we seem to get most frequently. And then hopefully we can talk a little bit more about the Academy. Thank you. Okay, so the very first website that I mentioned was www.npcertificationacademy.com, and it's right here. Then once you get there, you click on home, you scroll. When you scroll down, you see the courses right here. Pmhnp exam review, Ncmhce or AANP. Don't forget, AANP is new, starting springs for Pmhnp in 2024. You can now sign up. I think they're allowing people to sign up already. We have 99.9% pass rate with a lot of more information about us. If you're interested, you click on book here. As soon as you click on book here, it takes you to somewhere else where you can make your booking. All right. The next website I want to go ahead and take you through, before I exit this place, I would also like to show you some other courses and things that we do. We also offer FNP, AGNP, AGACNP exam review. Just in case I spoke too fast for you, you can pick up the visual image. NCLEX exam review is right here too. And we also do PN exam for NCLEX. In addition to that, We also have some like workshops on how to build websites. If you want to sign up, it's free. Please feel free to do so. We also have courses for DSM-5, which is diagnosis and is a prereq to pharmacology. And also, we also, create some workshops on how to write psychotherapy notes. So because this is a lot on just one page, we went ahead and created a new website just for consulting. Do you have a clinic and struggling to prescribe? Are you new to the job and you want to just try to get your feet properly wet before you actually go into the job? We also have created a nice little website for you. It is called confidentprescriber.com. That is confidentprescriber.com. It's our consulting page, a sister of MP Certification Academy. This was founded December 2023. Now, this is psychopharmacology. You can click on book here. It's going to take you to where to book. Psychotherapy and theory with documentation, DSM-5 TR consultation, and of course, the little summary of what we tend to help with, our mission, purpose, and goals, and of course, our contacts are right here. That is MP Certification Academy, address 42020 Village Center Plaza, Suite 120 to 174, Stone Ridge, Virginia 20105. Nursetonursecoach@gmail.com, confidentprescriber@gmail.com, and psatacademy@gmail.com. I really hope this is very clear to you now on how to reach us, how to contact us. We can help you achieve your goals and dreams and set you on the right path. All you gotta do is pick up that phone and call. Area code 347-901-6037. Apart from content, we also go through strategies. We also give you slides. Our slides are right here. It takes you through everything you need to pass the boards. The domains are listed as domain 1, 2, 3, 4, 5. The notes that you need are right there. You don't have to struggle to write your own note. You can just come to class, listen, take a little bit of note, and be able to have slides to go over after class without any hassle. A little bit of a glimpse of what our visual slide looks like. For example, this is neuroanatomy note written purely by me. And of course, that was written last year, and now students have access to it. Look, it's step-by-step guide, cerebrum, cerebral cortex, broken down and well thought. After this presentation, I will also show you a demo that I did in 2022 of typically what our teaching looks like and what we cover. Thank you and stick with me. We're going to take a little look at a demo of what a last minute review looks like. Please stick with us.
Academy. I remember touching base towards the end of last year to see where you are with your studies when it comes to psychiatric mental health nurse practitioner examination written by Ncmhce. So, believe it or not, this is January 15th now, and the middle of the year is gone. I mean, not the middle of the year, the middle of the month is gone, I meant to say. So, we have 15 more days. Hey, that's still a lot of time left. Remember, you can reach out for help. All you got to do is call me, 347-901-6037, or email Nursetonursecoach@gmail.com to get the support that you need to get you to another level. It is 2022. We got to step it up. We got to level up in peace. We got to level up. Learn from the best. All right. A quick review of what I talked about the last time. Domain 1. Do you know the parts of the brain? Do you know the functions of the limbic system? Do you know basal ganglia, and that we have 5 pairs of basal ganglia? And that is the putamen, substantia nigra, subthalamic nucleus, and so on. Do you understand those parts, and do you know what they do? Do you know the parts of the cerebrum? Do you know that cerebrum is different from cerebellum? Do you know the 4 dopamine pathways? The nigrostriatal pathway, the mesolimbic pathway, the mesocortical pathway, and the tuberoinfundibular pathway. Well, if you don't know it, you're not ready. Do you also know your chemicals responsible for probably your disorders? Example, norepinephrine, responsible for anxiety. Do you know that? Do you know there are 7 neurotransmitters that will likely be on your exam? Acetylcholine, dopamine, norepinephrine, serotonin, GABA-aminobutyric acid, glutamate, opioid neuropeptides. Do you understand that? Acetylcholine and dopamine have an inverse relationship. Do you know that? If you don't know that, you are not ready. And do you also know that There are certain chemicals and there are certain brain anatomies responsible for our disorders. Do you know those chemicals, and do you understand how to match up the brain anatomy with those chemicals? Well, I teach them in my review. I go that far. I teach in such a way that you will never forget in the exam. At NP Certification Academy, we don't read to people, we teach to people. Because I know you can read before you come to me anyway. So you need more help than that. Domain 2, do you know your scales, your psychiatric assessment? Your GAT-7, do you know what we use it for? And do you know what number that you need to assess for suicidal ideation? Do you know that number? It's a magic number. I'm not going to tell it. I'll tell it to you when you come to the review. What about Ncmhce? Do you understand how to assess your Ncmhce? Do you know that the higher the number, the better it is? Ncmhce of 25 to 30 is definitely what? Normal. That's what we want. Do you know another name for Ncmhce is called Falston scale? Do you know that? And do you know your Beck score? Do you know your Cal score? And your CWA? Do you know what all that mean? Do you know what astereognosis is? And do you know what stereognosis is? Do you know what graphothesia is? Do you know dysdiachokinesia? Do you know how to assess all that? If you don't know, you are not ready. Okay, examination hall is like a war zone. We can make that better for you. We can lighten the load for you. Why do you have to handle all that by yourself? No, it's not necessary. Absolutely not. And do you also know about domain 3? Domain 3 talks about what? The DSMs. That's how we diagnose our patients. Okay, they worked on it for 13 good years, so you can actually bank on that information. It's pretty solid. Personally, I like to diagnose. That's my business. Okay. Do you know how to diagnose OCPD and OCD? Do you even know the differences between the two? Do you know that OCD is ego-dystonic and OCPD is ego-syntonic? Do you know what that means? If you don't know that, you are not ready. And of course, do you know the difference between ODD and conduct disorder? And what is ODD? It is called oppositional defiant disorder. You have to be able to tell the differences apart. Well, ODD, we do what? We use our mouth. And conduct disorder, we do what? We use what? I'll tell you when you come to the review. How about that? Do you also know what intermittent explosive disorder is? Do you know your type of anxiety disorders? Do you know your panic disorder and panic attack? And do you know the difference between the two? Well, you better go know it, or I will help you to know it. All you got to do is go to www.npcertificationacademy.com to sign up. And I will end my domain 3 right there. Let's talk about domain 4. Domain 4 talks about what? Psychotherapies and theories. Don't forget. It talks about psychotherapies and theories. How are you supposed to study your psychotherapy? I teach it. I'll tell you. It's not a secret in my review. I give it all to you. I also give you slides to support you all the way through. I give more than 300 slides to my students. I also give them a set of 100 questions to even further support them. Those 100 questions are close to what you're going to see on the exam, ANCC exam. They are not the random commercial questions that you see on the street or that you see on Amazon. These ones are well thought through, and they are actually from ANCC. I don't release the ANCC test, but I am able to research for those content that they put out, and I'm able to use it to help my students. I also review Quizlet questions in my review. Well, I didn't put them on Quizlet. Somebody put them there, and I know I use it as a resource also in my review. My last minute review is integrated with my packages. And now let's continue with domain 4, psychotherapy. We have the individual therapy. We have the group therapy. We have the family therapy. Well, let's talk briefly about what? The individual therapy. Number 1, the cognitive therapy. What is cognitive therapy? When you think about cognition, it has to do with the head, thinking. And then therapy means what? Treatment. The same way we rate our pharmacotherapy, or we need to put that psychotherapy on the same level, practically. We need to respect it that way. It is treatment too. And it's not quite easy for nurses because we never did it. So your psychotherapy means talk therapy, just using things to speak to our patients so they can get better. We get them to talk to us, and then we see how we can support them using certain techniques. We're just not talking. We're using certain techniques to get them to where they need to be, or where they should be, excuse me. So cognitive therapy, we're using that, exploring the patient thought process. What are they thinking about? Exactly what is in their head. We try to explore that. We try to give them homework. We also have them record their records. That way we can see what is in their mind. Remember, we don't know what is in their mind unless they write it down or they say it to us, and that is called thought content. Thought content is what their thought contains, what they say to us. And that is cognitive therapy in a nutshell. It's extremely important to use it for people with anxiety, depression, and so on. The theory, the person behind cognitive therapy is Aaron Beck. He believes that, a lot of this psychosis that we go through is not because of what we can see. It's because of what we are thinking about. It's because of our thought. For example, COVID-19. The way we think about COVID-19 will determine how we react. We determine whether we're going to have anxiety or not. The way we think about it, our thought process, whatever we ruminate about. Okay, a lot of people, when they go through stuff and they start to think the worst about it, we call it catastrophizing. And people that we use CBT for also, they think all or nothing, and there's something I would call overgeneralization. They tend to do that a lot. Okay, that's my little clip of psychotherapy. I teach a lot more of that. I talk about family therapy and your techniques and how to remember them. I talk about the solution-focused therapy. Think about solution-focused therapy. To find a solution to anything, you have to ask questions. Right? Example, miracle questions. Exception finding questions. Scaling questions. How did they test you on that? I teach you in my review. Again, www.npcertificationacademy.com. My cell phone, 347-901-6037. Or you email me at Nursetonursecoach@gmail.com. Domain 5. That is the roles, leadership, and ethical principles. There are 5 main ethical principles. Sometimes some people come up with 7. But for testing purposes, there are 4 common ones, 5 common ones, excuse me. That is justice, autonomy, beneficence, non-malfeasance, and of course, respect. The high yield ones, I will tell you when you come to my review. And how are they supposed to test you on that? They will not ask you for definitions. There is a way they will test you on that. And I'll put you through, okay? In our review, and that ends the domains. And then you're thinking, where the heck is this domain from? Okay, let me tell you. Domains, I didn't make it up. If you Google up Ncmhce Test Content Outline 2019 for Psychiatric Mental Health Nurse Practitioner examination, you will see it come up on Google. Or you go to their website and look for the Test Content Outline. You can see the Test Content Outline as a syllabus that you have to go by. Okay, it takes a while to actually arrange your notes according to the Test Content Outline. I took a whole lot of time to do that for you. I'm working hard for everybody to make sure everyone succeeds. So guess what? I have put together my notes, over 4,000 slides, according to the Test Content Outline, and I teach a whole lot of them. For that reason, my review is not a 4-day review for me to say bye-bye to you. I take $300 from you and I tell you bye-bye after 4 days. No. Let me tell you, after a 4 days review, you don't know anything. So I came up with something that works for everybody, for every learner. The kinesthetic learner, the auditory learner, the visual learners, and that is what? Something that looks like a school. I have 3 weeks packages. You can come in the morning, you can come in the evening. My class will be repeated. I teach for 3 days during the week and teach 2 days during the weekends. So you can't miss out on anything. Unless you're working 7 days a week, you will still have time to come to my review. I teach from 8:30 in the morning to 11 a.m. And then in the evening also from 8:30 p.m. to 11 p.m. Eastern Time. And on Saturdays and Sundays, I teach from 8:30 p.m. to 11 p.m. Eastern Time. So to find out more, text or call me 347-901-6037. Speaking of the other packages, I also have a 7 weeks packages for those that would not really have time to sit still or settle in the class, or they're in the military and they have to go in and out. I also consider those. Or people that don't have a stable schedule and they will just have some kind of issues for one reason or the other. It's good for them. It's called a flexible package because they can actually extend for 2 weeks or more as needed. And they can also definitely get extra free one-to-one with me before the test, just to assess where they are. To learn more about my packages, again, you can call or text me or go to my website. If you want to prepare alone, I wish you the very best. I can still be your resource. All you got to do is email me for any question, whether you sign up for my review or not, and I will be there for you. My goal is to support nurse practitioners in the entire world, and especially across the United States. If you have any questions, you can email me. I will respond faster than a call because a lot of times I'm teaching. However, I do return calls. So, that is my spiel for the day. Watch out for more videos. I'll talk to you later. Bye-bye.
Wow, that is so interesting. I just find myself here, a lot of things running through my mind. Like, wow, 2 years goes by fast. That video was recorded in 2022, I believe, January 15th. Today is January 5th, 2024. So it's so interesting to sit down and be watching myself. The changes that have taken place, my face then and my face now. I try to match my outfit. I try to match my hair so I can look about the same. Okay, so that was just deliberate, but it's a good thing that I still wear the same clothes at least. Okay, so maybe that's good news. All right, so what you see right now is what you get. Okay, I'm very chilled, laid back, very, very approachable, very, very personable. Empathy is a huge thing for me. I also make sure that everyone is taken care of. If you reach out to us, you don't reach us the second time, please don't get mad. The email is there. So sometimes we do miss messages. There is no perfect review out there, but we make sure we do our best to serve you. When you do come to the review too, sometimes we do play videos and I'll be right there moderating it. We do give bonuses. Bonuses are pretty much automated for the most part because, you know, I have kids, I have family, I have life too, right? So we try to balance it all out. So if I have to do anything extra out of my review, we go ahead and play past Quizlets or past full set questions, or even in lectures. If I want to like relax my voice a little bit, you will see me moderating my past lectures. But the bottom line is there's somebody right there no matter what, and that is a big deal. The minimum time for our review right now is 6 weeks. We no longer offer the 3 weeks. So please feel free to reach out to us. You're not going to regret it. It's a promise. If things did not go well for you, God forbid, we actually offer free remediation. Would you give it a try? Please do so. 347-901-6037. www.npcertificationacademy.com. www.confidentprescriber.com. Have a wonderful day. Bye-bye.